you know, we have maybe some other folks that are new to this field. So I hope that you enjoy this presentation and that you participate in some of the opportunities to share in your input and feedback. Let's see what else I wanted to say. Well, I'm going to go ahead and get started sharing my PowerPoint. Let's see. Okay. Am I sharing the right thing now?
Yes.
Okay. Alrighty. Let's see. Okay. Here we go. So the topic for today's presentation is on exploring the CHW workforce development ecosystem and CHW professional development pathways. This I have presented this before, so made some updates, and again look forward to the contributions of some of the other CHW's instructors that we have in this webinar today. So I'm Guadalupe Cornejo. I am currently an assistant professor of community health at Northwest Vista College, and I'm also the founder and lead organizer of the San Antonio Community Health Workers Association. So at this time, I will ask if you're able to type in the chat, and if you can introduce yourself to the group by adding your name, your title if you're working, and your affiliation. That means your employer or the school you attend to if you're currently in CHW training. I will ask Cheyenne if you can please help me out if there are any questions or comments that are posted. So if you can help me out and let me know if I need to stop and address those questions, or we can wait until the end.
Okay, of course.
So for today, some of the objectives I want us to talk about is to describe the CHW workforce ecosystem, identify the CHW workforce development efforts, the current efforts, and some of the employment opportunities, or how to provide you with a framework to think about where else you can go to find or look for employment opportunities. We will share some existing professional development opportunities and higher education pathways. I will clarify that some of the information that I offer is primarily focusing here in San Antonio, Rivera County, but it may be applicable in if you use the same format as to what you can look for in your county or city. Hopefully this will be helpful. So again, as we're talking about professional development, one of the frameworks that I use to help me really understand what are some of the skills that I need to develop is by simply referencing our Texas Department of State Health Services CHW core competencies. If you look at this chart in front of you, you have we have 8 different competencies that we must develop skills on. And so you have, I have listed some of the ones that I feel apply to the presentation today. And sometimes you may be sitting there and wondering, what else can I do? What other certification or what other continuing education or what skills am I lacking? And so hopefully by adding this, this framework as a guide for you, you will be able to answer those questions as you progress in your professional or job as a CHW. Today, you will be receiving 1 hour of certified CHW credit, and I divided them up into the knowledge base on a specific issue and advocacy skills. So I do hope that with this presentation, we as CHWs are able to develop some analytical skills that will help us to assess and perhaps to do an inventory of our personal strengths and identify some areas of improvement and that we as certified CHWs can develop and just to really acknowledge and be proud of who we are, how we have evolved in this I would say this past 20 years here in Texas. We are continuing to evolve as a profession. As you have noticed in the past 3-4 years, we have gained recognition at all levels, local, state, and national levels, and even global levels. So be proud of being part of this evolving workforce. I will be, in a moment, I will be sharing a link to a Google form. So for those of you that will be needing the certificate, so you can please fill it out to make sure that I have the right name and email so that I can submit that to the state. I have this activity that I hope we can do. So before I go into the content, I like to ask for a moment of reflection. And if you have your phone, if you can scan this code, or I will drop the link in the chat. And I like to ask you to reflect on these two questions. What is one example of something that a supervisor, a coworker, or a CHW instructor or a mentor did for you to help you grow as a professional? Whether that is something that you approach them to help you or support you, or whether that was something that this person took initiative in sharing with you. So that's question one. Question two is, what is something that you accomplished and that you are proud of in this past year of 2023? So let me see if you can scan the code, or I'm gonna go ahead and stop and share the link if I know how to do this. Let's see. Oh my goodness. Okay. Oh, those are all the comments. Okay. Let's see. And I'm gonna go ahead and share the screen. I don't think I was able to find the link. Okay, am I sharing the right screen? And I wish I knew how to turn off the...
Sorry, there's no screen being shared.
No? Okay.
There you go. We see smart.
All right. So here are some of the questions. I may be hopefully just be able to later on, maybe when we submit this, just to share this with you after the presentation. But I wanted us to just look at some of the things that you have done this past year, and some of the things that other people can help you, right? Because when it comes to our professional development, it's more than, it's a team effort. It's what your supervisors, your team provide for you to grow. And also, what are some of the things that you as a individual take the initiative to do? And so with that in mind, I'm going to go ahead and proceed, and I will try to share the link at the end. Yes. But let me see. I do want to see what are some of the answers though. Okay, so let's see. Let me go ahead and share again. Okay, so also on the question, what is something that you accomplished? starting this professional development series. All right, that's wonderful. And again, yes, because some of these things that you do for your professional development require of your own initiative to do. Lead several initiatives and conducted research to support the need for outreach. I'm proud of encouraging others to set goals and chase dreams. Let's see, what else have people done to help you or your supervisor or someone else? Allowed me to work on a special project that expanded my leadership and community skills, provided me with more insight of the program to better understand my role. Yes, the strength of my leadership skills. Supervisors share these training opportunities with me. Wonderful. Thank you so much for sharing, taking the time to participate in this activity. I will review your comments because this is wonderful information that help us as community health worker instructors and of course give you ideas as CHWs on what are some of the things that you can ask your supervisors to help you with or your mentors. So thank you again for your participation. I'm going to go back and share my PowerPoint again. All right, so keep that in mind as I move forward with this presentation. So first of all, I like to describe the CHW workforce ecosystem. And I always like to talk about this because sometimes when I get new students in my classroom, you know, a lot of some come with an idea that being a community health worker is just being out there in health fairs and setting up tables and talking to people in the community. And I always say, yes, that is part of what we do, but that's not just what we do. And so the CHW workforce, you know, we are part of the public health workforce. And as such, some of you, and we also do community-based, community health promotion only efforts. But as you can see, if you look at the diagram on your left, you can see that CHWs can be placed or can find work in all these different areas. You can find jobs with governmental or public health agencies. You can find work with community-based service organizations, which we see that a lot here in San Antonio and in other areas in Texas. You can be employed by academic and research institutions, even by private organizations. So I always bring that out because sometimes we think that the only employers for us as options, you know, are the ones I mentioned above. But we should also start looking at the private organizations in the private sector and see, you know, what jobs align with your skill set as a CHW. Of course, there are some CHWs or quite a few CHWs that are employed by hospital and medical groups. And so keep that in mind, especially if you're new to the field and you're like, well, I just got certified and I have no idea where to go to find a job. So keep this in mind as we move forward and you know, begin exploring all the different areas. What you have here next to is a employer survey that was conducted in 2020. And from this report, there was a total of 841 employers in this database. And of those, a sample of 181 responded some of these questions. And as you can see here, they were asked how they describe their organizations. And these are the organizations in the state of Texas that employ community health workers. And at the top, you see that leading this chart is hospitals and clinics, followed by nonprofit organizations and by federally qualified health centers still within the clinical setting. And then you have community-based organizations and so on. So this is from 2020. This is a report that's posted in the Texas PSHS website. And so here is what a representation. This is self-reported information from members of the San Antonio Community Health Workers Association. We currently have 345 members. And this is the distribution of how they report where they work. And the organizations involved are the ones that have the most numbers of CHWs employed. Obviously, we have seen in San Antonio an increase in the number of CHWs employed by the City of San Antonio Metropolitan Health District, followed by in the community-based service organization, again, based on this database. Family Service has a high number of CHWs, or the highest number of CHWs of our membership. And then UT Health San Antonio as an academic or research institution. And for private organizations, we have Maximus. And then at the bottom, we have Central Med and University Health System and Methodist Healthcare Ministries leading the chart in terms of the most CHWs employed within these organizations. So in terms of the next learning objective here is to identify CHW workforce development efforts and employment opportunities. And so first, I want to start by defining workforce development. And so we can define this or we can understand it as the actions and activities that a group of CHW stakeholders that includes aspiring or certified CHWs, that includes training organizations like Northwest Vista and others. It also includes community colleges, employers, community-based organizations, and government organizations at the different levels at the federal, state, and local level that are joining forces and resources to prepare people for employment or to help employ CHWs advance in their careers and support their efforts to make sure that we as CHWs become or advance our skill set and remain a skilled workforce. So these efforts, as you may know, can be influenced by factors such as the disposition of funding. And again, it is influenced by the federal, state, regional, and local needs or the context, as many of us experienced during the pandemic. Such a huge highlight in terms of public health efforts and community health needs. And therefore, we have seen in this past few years an increase in funding to provide training and increase the number of CHWs in our workforce. Some examples of these efforts is the Affordable Care Act. As you'll remember, back in 2016, through the implementation of the Affordable Care Act, we saw a number of opportunities for CHWs to help with the enrollment process. Of course, we have the COVID-19 pandemic, and we will see how the current Medicaid and Medicare will impact these local efforts, as we as CHWs will be able to get some funding or get paid for this organizations and CHWs to get paid for the services that we may offer. Let's see what else I have here. Cheyenne, this is where I need your help. I will talk about this specific example of workforce development, and I will ask Cheyenne to talk about the South Texas CHW Workforce Preparedness Collaborative, which is the leading, which thanks to these efforts, we are here today talking about or providing this webinar series to help with professional development for CHWs.
Yeah, thank you. So our training, we have 6 training partners. 5 of them are together under the South Texas Area Health Education Center. They're scattered across South Texas. And then we have colleges / Northwest Vista providing training in San Antonio. And so we train new CHWs, but we also, and we especially want to make sure that CHWs are reaching into the most rural areas of South Texas. There are counties still in South Texas that do not have community health workers, but we also want to upskill the current workforce. So this is why we're providing this professional development series, but we also have heard from you all. Guadalupe, should I talk about digital literacy now, or is that later? Okay, so we've also heard that the training to be a community health worker is great, but some people do not feel as comfortable on a computer. And there are ways that using Excel or PowerPoint can make you better in your role and make you and help you to better serve your community. We've done effective presentations. We did do an Excel workshop, although Excel is really hard to teach in a virtual environment. And so we're listening, and we now want to offer in-person computer classes. So each of our partners is exploring an educational partner, such as a community college, to partner with. I'm very excited that in San Antonio, there is, starting in February, but also in March, we are going to be partnering with Goodwill to provide free digital literacy training. Depending on your starting point, it will start anywhere. It'll be a 2-month course or a 3-month course. If you want to be one of the first people to sign up, then I need you. I'm going to copy the link. It's going to be the correct link this time. I'll put it in the chat box. So if you are in, actually, I would like everyone in Texas, sorry, this will only be for people who are in Texas, to complete this survey and select that you're interested in digital literacy skills, and we'll be in contact. We're getting started now in San Antonio, but all like in Laredo and Corpus Christi, everyone's interested in doing this. If you want to be on our listserv to sign up for in-person digital literacy or computer classes, just fill that out. And so as we hear of other professional development needs or learning needs, we're listening. So tell us, and we will try to link you with resources.
Great, thank you. All right, I'm gonna try to share my screen again. I lost it. Let's see. Okay, we're good, right?
Yes.
All right, so thank you for that information, Cheyenne. All right, so when it comes to, so that was just one example of how, what opportunities are currently undergoing and as part of an effort with different stakeholders. Now I want to focus on what can you do as an individual to improve your professional development. So I want to play this video clip from one of my favorite movies, and let me see if I can share this. How do I do this? Hold on. Is the volume already on? Can you hear that?
Yes.
Okay, thank you.
The IBM 7090 data processing system. It has the capability of solving over 24,000 multiplications per second.
Holy Moses, that's lightning fast. They'll never get that to work.
Oh, it'll run eventually. And when it does, we have to know how to program it. Unless you'd rather be out of a job.
No, ma'am.
Mr. Z, I got a court date.
The computer uses it as its high-speed storage unit and information holding device. So you have a brain. That I can work with. Well, that's in the wrong spot. Atta girl.
Okay, so what did you see in that? What did you see? What was happening there?
She took initiative to go and learn a new skill so she could be used later on.
Correct. Thank you, Betsy. Yes, so we are in a field where you attend to many different trainings, webinars, and whatnot, right? This field is about yes, it's about adapting to change. It's about using your brain to how do you apply what you learn in a webinar and adapt it to what you do and help your organization and help the population that you serve. So you have to be creative. You also have to be anticipating what is your organization needing. What are some of the processes that you can improve based on the experience that you have while serving your patients or clients? And what are some of the things what are some areas in terms of skill sets that you need to develop for yourself? And as Shay mentioned, and I will talk about, share some results of a previous survey, and for the CHW, we're such a diverse workforce. We have individuals that have high school diplomas. The majority have associate's degree or their certification. And also our certification process is different. Like not everyone goes to a community college, where you kind of have more of a formal training. We have CHWs that are certified by experience and maybe in a way limited to that specific job position that they have. So what I'm saying here is that there's a lot of opportunities for growth, but you have to be the one that identifies those areas for you as an individual and be very attentive to what are the needs of your organization and the population that you're serving. And that's like an ongoing learning process. So yes, if we don't adapt, yeah, we can be out of a job. Not to that extreme, right? But we are evolving. There is new technology that is being incorporated to help us improve our processes and be more efficient. Computer skills, right? Basic computer skills. That's one area that a lot of local employers have identified for us, that we need CHWs to be proficient in entering data, processing data, and being, capable of pulling reports, creating PowerPoints and whatnot. So again, I always get excited when that's one of my favorite movies, because it helps me remind myself that my development is kind of my responsibility, right? And so with that in mind, let me go ahead and continue sharing my screen again. Let's see. So sometimes we may be, wondering, well, where do I start? So I'm providing this framework on your, on your right side of your screen, this diagram, right? So how can you start identifying areas of opportunity? I will say you have to start looking at getting to know your organization. Know your organization, who they serve, what is their mission. Then look at your job description. What are what were you hired to do? And who is the population that you're serving? Is it children? Is it the elderly? Is it students? And what are their needs? And you identify this as you are working with them. And you a lot of times may find ways that you can improve some of the processes to intake or deliver services. And you may identify areas that you say, you know what, I don't know how to do this, but I can learn, right? Also use the CHW core competencies. Look at each one of the core competencies, look at the set of skills that are listed and more, and focus on some of those to help you develop the skills. So develop opportunities to pursue that new skill that you need to help you be a better CHW, to help you improve your whatever is the skill set that you have identified that you need to develop. So let's see. In terms of looking for employment, I do, get questions. Ms. Cornejo, I finished the training, but I don't find any jobs. Well, where are those jobs, right? And I always say, look beyond the CHW title. We still have many organizations that employ community health workers, and that we have the skill set to meet some of the needs that these organizations have, but they use different titles, and we're not there. I think we are seeing here in San Antonio a number of organizations that are trying to standardize the use and incorporate the CHW title for some of the job positions, but not everyone is there yet. So these are some of the other titles, and this came from the San Antonio CHW Association. Some of you, these are the titles that you have. It's not always CHW. It can be outreach coordinator. It can be Patient navigator is a very common one. It can be community engagement specialist. So you name it. Think outside the box. Look at these organizations, the different organizations that you think can employ CHWs. Read the job description, align the skill sets that they list to what you have and your CHW competencies. And those are different opportunities that you can incorporate to expand your employment search. Think about organizations that help shape community health. Again, for CHWs, our job is more than filling out applications or attending health fairs or why not. There are so many different areas that we already contribute and that we could be contributing more to ensure that the organizations provide better services for the populations they serve. And so we can think about these 3 different organizations that respond to health-related problems, whether that is, the need to provide health education, whether there is a need to deploy a team of CHWs to conduct a needs assessment, you name it, right? But here are just some examples. First, you have obviously government organizations at the different levels. On this example, I'm using the federal and state examples. Look into these organizations. They always, a lot of times, these organizations have local opportunities. Or if you're ready to move out of Texas, this is also another opportunity to look up what else is out there outside of Texas. And of course, the local organizations could be, the City of San Antonio Metropolitan Health District. You have quasi-government organizations that include American Red Cross, National Science Foundation, and others. And of course, the non-governmental organizations that includes different nonprofit organizations, professional health organizations or associations. So in terms of making sure that we have a strong workforce of community health worker workforce in Texas, we advise and recommend that you pursue your certification if you are practicing as a non-certified CHW, and that you maintain your certification if you already are. As we are looking, as many other employers are learning about what we do and how we can be part of their workforce, they may want to look at the number of CHWs available in different areas. And maintaining your certification helps with that, to show the number of CHWs available in the different areas in Texas, and it will help again to advance the profession, not just as an individual effort, but to see the representation matters. What I'm trying to say. Another thing that you can do is to find a mentor. We had a webinar in the past talking about the role of a mentor and a mentee, and it really makes the difference to have someone that you can discuss, your aspirations, and this are usually people that are experienced or have connections and can help in your journey. So consider finding yourself a mentor. Pursue additional certifications to expand your scope of practice. Some of the examples we have here is, there is a mental health first aid instructor. Again, depending on where you work, your organization may be able to pay for your training and incorporate this new skill set to improve the services that the organization offers. So don't be afraid to explore these opportunities or bring these opportunities to the attention of your supervisor and your team. Many of us speak other languages other than English, and the medical interpretation it's in high demand, and it's an option. You can get trained and certified as a medical interpreter. And I posted this link. This is a local organization. I was not able to get hold of them to get an update on the cost and sessions, but their website is available, and you can find that opportunity. Also, organizations like hospitals and other big organizations may provide training to their employees. So I recommend that you reach out and ask if that is the case, and pursue those additional certifications to enhance your employability. There is another peer specialist, and that is for individuals with experiences in mental or substance use disorder. And there is this formal training. The cost is about $650, and the link is in. I'll provide the link, but that's another. This is just a couple of examples of things that you can consider to add to your resume. And Cheyenne already talked about the CHW instructor. There's some things that well, she's working, or as a team we're working on how to do the CHW instructor. There's some things that need to be clarified, but it's another opportunity for CHWs to advance into the next level of a CHW instructor. Some other CHWs have pursue creating their own nonprofit, and so that's something. If you're ready for that, there is some guidance, or find a mentor that can help you with that. Cheyenne, you raise your hand.
Yeah, there's been some chatter in the chat box that I wanted to draw attention to. So Betsy Coates at Maximus put a link to check for job opportunities, so thank you. And then there's Ramon, you asked about how to get involved with the so there's the San Antonio Association for CHWs, and then there's the State Association for Promotores and CHWs. Betsy, thanks for putting a link for the Texas Association. Actually, so Susie put in the link for the Texas one, and then Betsy put in the Facebook link. I think that's the San Antonio one. Yes.
Thank you.
I
I
also
just
want to
got
say,
recertified. I just got my license back again. I had got it a long time ago. Then time went on. I got recertified. So trying to catch up again. So thank y'all.
Excellent.
yeah, I know that you are one that had lost your certification and came back and got recertified. So thank you. It also looks like Delcinia's organization pays for certification. If you're employed, definitely ask your employer for professional development funding. They might have funds for you to get continuing education, stay certified. I hope that more employers are doing this. My employer does this for me. It's a way to retain employees. It costs money to lose employees. So, and if you're not satisfied with your current professional development opportunities, but your organization wants to retain you, then that's something to come up. It's an additional incentive to stay employed. There's a suggestion to look at Umemba or Texas A&M, also University of North Texas at Fort Worth. They each of those three organizations provide CHWI training on. I know Umemba and University of North Texas is online. There was also a question before we move on. So Desenia, you asked, do you know of a way that you can become certified in Texas living outside of the state? If you can, let me know where you want to work. So I know Umemba will train people across the US, but their training is only to certify people in the state of Texas. So if you want to clarify your question, we might be able to answer a little bit more.
Yes, ma'am, I can, and thank you for that. So my company, McKesson, is opening a CHW training, but and I am a community health worker in Tennessee. However, we do not have license or certification for that aspect, although I've gone through training through Meharry Medical College and Baptist. I've gone through training through several colleges. However, there's no actual certification. But for the role that I'm pursuing with McKesson, they're looking for someone that is certified. And so while I still live in Mississippi and work in Memphis, Tennessee, I need to be certified in Texas for that role. So trying to see if the certification is only for Texas residents.
So, well, Guadalupe, do you want to, or maybe Belle, do you want to respond to this?
Yes. To be certified in Texas, you have to have Texas residency.
Okay, so that answers my question. Yeah.
But Dulcinea, it's the same training. So like I went through Memba actually to be certified as an instructor. It's at the end, everyone does the same training, but at the end, people who are residents of Texas would apply to the state for that licensure with the state. So you might want to check with McKesson as if it's like, what if you did the certification training?
Yeah, and the training is fine. And my manager and my VP, they're perfectly comfortable with the training that I've had with the two colleges that I've been through. However, it's not a licensure, so I guess that's what it is. So looking for something licensed for this role that's coming up. So we're always talking about professional development. So the role is not even open yet, but I know that it's in the pipeline. So hoping to be developed to actually slip into that position because according to them, I'm ideal for that position, just need that certification. So
yeah, and this is a good point to bring up that states are different across where they're in different stages of professionalizing the CHW role. So for example, I took a certification course in California to become a CHW, but it's not a state certification. It was like a certification that I received through community college. So then when I came to Texas, I'm not certified as a CHW in Texas. So yeah, language can get tricky as you move from state to state, but I think across the US, there's more and more support for professionalizing the role, which is great to see. Back to you, Guadalupe.
thank you.
All right, thanks for the conversation. Let's see. I'm going to skip to skip a lot of slides here, but let's see. I think already most of us know, right? What are some of the things that we can improve as a workforce? And here they are. This is based on a survey that was conducted here in San Antonio. And let's see. I think the most important one is the becoming familiar with the Microsoft suite and being able to continue your networking, because you we as CHWs bring, and we already have this. It's just a matter of doing an inventory of the different organizations that you're connected to, whether if you are receiving services from them, if you're volunteer with them in the past or currently, if you work with them, they're in your community. Just really make an inventory of all the organizations. That's what all the organizations that hire community health workers, they want your social capital. That's what adds value to their organizations, because you have those connections, direct connections, and that's what adds value to USA CHW and for this organization. That's what they need. So maintain your network, attend sessions like this. As you see in the chat, one of the reasons I asked to add your name, title, and affiliation is because you can see the different organizations that are present, and you have a direct name and someone that you can reach out and mention if you need a connection with such organization. In terms of another area I like to talk about is higher education. For me, as an immigrant, and what has helped me develop and professionally is through education. So we have CHWs that say, you know what, I'm fine with my certification. That's all I need, and that's my plan. But you have other CHWs that want to pursue other options in terms of pursuing higher education, whether that is an associate's degree or leading up to a bachelor's degree or master's degree, you name it, right? So there are some opportunities in different community colleges. I will talk about what we have here in San Antonio, and in San Antonio through Alamo Colleges in Northwest Vista, we offer a pathway for CHWs that obtain their certification as continuing education. Once they enroll as academic students in Northwest Vista College and they obtain at least 6 academic credits, they are able to convert their continuing education credits towards a associate's degree pathway. And so that's an opportunity that can lead eventually to you to pursue a bachelor's degree. And just to give you an idea of what are some of the options to consider, let me just go ahead and share my screen again. So this is the degree plan for the Associates of Applied Science that we offer at Northwest Vista. Again, I'm sorry that I'm focusing just locally, but this may be something that you can explore with your county or in the city that you're joining us from. Let's see. So if anyone is interested in pursuing an associate's degree, you can email Dr. Martinez, and on the screen is his email address. You can always email me directly, and I will be happy to make that connection. Now, when it comes to a 4-year degree pathways, these are some options that you may be interested in pursuing. For us at Northwest Vista, since it is an Associates of Applied Science, the next step will be to transfer into a Bachelor of Applied Arts and Science. Texas A&M San Antonio is one of the local universities that takes our students. I myself, I went from the associate's degree at Northwest Vista College to pursue a Bachelor of Science in Health at UTSA. Of course, not all my credits from my CHW certification transfer for my degree, but it was, for me, that worked for me. And then after that, I pursue my master's degree in social work. But there is also a Bachelor of Social Work and a Bachelor's of Arts in Sociology and in Public Health. So those are some degree pathways that you can pursue if you are interested in taking your education further. I think I want to stop here just to allow maybe some time for comments or questions. Keep up your certification. I do have the numbers of preliminary numbers for Texas for 2023, and in the previous report that was published, was it in 2022, we saw that the CHWs that obtained their certification based on experience, that group had the lowest number of renewal. And of course, we don't know why, right? That wasn't necessarily covered in the report, but I just think that being part of an association, whether it's local, state, or national, helps a lot with the networking, helps a lot with options for employment. Here in San Antonio, I get job postings that I forward to the CHW members, and I do hear for some employers that sometimes they have a hard time finding candidates, CHWs, for their jobs. So also, don't be shy. Do not disqualify yourself before applying. In San Antonio, we do see that the majority of the jobs say that bilingual prefer. If you don't speak Spanish, apply. They may look at other things in your resume. So don't disqualify yourself even before applying for the job. Let's see.
Yeah, there's just a couple needs expressed in the chat box, or chat about working as a CHW with probation workers, or so maybe like transitioning back from incarceration, and then also finding conversational Spanish courses or Spanish writing courses. If anyone has suggestions, you can put that in the chat box. I'll make sure it gets out in a summary.
I felt bad just talking about Northwest Vista, but that's what I know because that's my employer. But community colleges in general a lot of times offer the Spanish courses. The resource I share on the translation programs, they also offer some of those, but I'll be transparent. Those are private organizations, so again, they may not have their trainings. I don't know about the cost. That may be something that you need to look into it in terms of the cost of the training and the quality of the training. With the community colleges, tuition tend to be more affordable, right? So and they're reliable organizations too. So, and Duolingo app is free. Someone put there. Yes, that's correct. But yeah, Northwest Vista College, for example, offers Spanish courses. You may also want to consider taking a medical terminology course in Spanish, or even a standalone, depending on where you see yourself practicing, right? If you look at practicing in clinical settings, that will definitely help you a lot to have better communication with other clinicians. Yeah. Our Lady of the Lake University, yes, okay. Bachelor's in social work, yes. I think that's all I have. Let me see if I missed anything that okay, so I did the US Department of Labor. That's another resource that there's a lot of links there to local, state, and federal opportunities for trainings and even scholarships. So that's another resource outside of just directly the community colleges. So let's see, what was the question in terms of working with how to align this training with probation officer? Did I hear something? So I would say, and Val and someone else help me out. Eric, you want to?
Yeah, no, that's what I was asking.
Okay. So, well, when you become certified as a CHW, we talk a lot about social determinants of health. So we talk about how it can improve. The employer may not necessarily ask for a CHW certification, but the knowledge and skills that you learn in the CHW training will help you tremendously on how to communicate with the population that you're serving, on how to identify community resources, and how to improve your communication skills, your nonverbal skills, your writing skills, and how to be more understanding of where people come from, right? Understanding their trauma, understanding how they can, how that led to where they are now, perhaps. And so it aligns, it supplements that type of work. But again, maybe that's an area of opportunity for the collaborative here. How can we incorporate CHWs into this area? And don't, I mean, those are some of the things that as you get yourself an interview, you're able to elaborate further on what you bring to the table as a certified CHW to this position.
Hey, Eric, can I ask what was your question exactly, Eric? Eric,
What did you say?
what exactly was your question?
Well, I'm in school now, but I'm also trying to see like, hey, I'm trying to do probation work, work with the younger youth, as a community health worker. So I want to kind of get the insight as far as like being on track to be a probation worker with the younger youth, and see like, hey, what steps are needed to get into that line of work, and does community health worker, does that qualify to get in that line of work, or do you have to be a social worker to get in that line?
Are you in San Antonio? Are you in San Antonio?
Yes, sir.
Hey, go down to the Bear County
Yes, sir.
Reentry Center. Look it up on the internet. Bear County Reentry Center, and they'll help you out.
Okay.
Okay.
Yeah.
Okay.
In San Antonio, we also have a Stand Up SA, which is an initiative with the city of San Antonio, and they have resources. They do work with, violence prevention. So it aligns well in the sense that you gain access to information that can help you provide you the knowledge and skills to develop programming for the youth and violence prevention and reentry programs. So again, it will come down to you, Eric. How do you use this knowledge to help you get to where you want to be? I mean, it's the CHW field is so diverse. And again, once you have a good handle of the knowledge and skill sets, you can really literally align to anything that you want to do that has to do with working directly with people or communities or groups or families. Oh my goodness. Okay, I didn't share the link for the attendance. So give me 1 second.
So I'll stop recording now. Thank you.